Hey, it's Huang here with Hand Therapy Secrets. Welcome to my show. Today I've got a special guest. Her name is Eizabeth. Not only is she an occupational therapist and a certified hand therapist that has her own private practice, she's been running for 20 years. 20 years she's been running this private practice. It's amazing. Not only that, how did she have time to write a book? So she is the author of Evidence-Based Hand and Upper Extremity Protocol book, and this is her second edition. She just released this year. We are going to talk to Eizabeth and get some of her insights into some of her story of how she became a certified hand therapist and how she got into private practice and how she started writing this book. So this is one of the go-to books for if you are looking for a protocol book and you're just like, I'm new to hand therapy, I've been working in hand therapy for a while, and it's nice to have a protocol book that you can just look at the content and then you like find out where your particular injury is and you can get answers right away versus going into like a textbook and reading all that stuff. That's something for later, but these protocol types of books are really awesome because you can get help from them really fast, especially when you're on the go in the clinics. This is her book that she just released, so listen to her story. Hey everybody, it's Huang with Hand Therapy Secrets. Welcome to my show. Today I have Eizabeth DeHerter. She is a practice owner, private practice owner, and also the author of Evidence-Based Hand and Upper Extremity Protocol. You see her book right next to her. So welcome to my show. Thank you so much for joining us.
Thank you for having me.
Well, I wanted to have you on because as, you know, myself as a business owner, I'm always interested in seeing and sharing other private business owners. And not only are you a private business owner of 20 years, but you also have written a book. And this is your second edition, am I correct? Yeah, your second edition. So I wanted to have you on the show, and I know that a lot of people do approach me because I have a private practice and stuff like that. And I think a lot of people do look for some inspiration in terms of like, can I do this myself too? Can you share a little bit about your story of going into private practice?
Sure. So I was actually always worked in big medical complexes, trauma centers, worked at UAB for a while at MUSC. And one of the hand surgeons that I was really close to and I still work with, I've worked with him for 27 years. He was going into private practice at that time. Now he's back hospital based, but asked me to come work with him. And I said, well, I'd rather, you know, if you'll let me do my own thing. And they did. So that's kind of how it evolved, although I didn't know a whole lot about that because being in hospitals, you know, I didn't know about all the contracts and all the, but I learned. And sometimes I learned the hard way. I made a lot of mistakes the first year for sure and probably lost a lot of money. But you know, I worked really hard and I was very frugal. I made a lot of my own equipment and you know, now I've got 4 OTs that are working for me and 3 office staff, and I have 2 locations. And I've been, the surgeons have grown, and so my practice has grown. And so it's been a really amazing journey, and I'm very grateful to probably 80% of my business comes from hospital-based surgeons, and they had their own OTs, but they, and hand therapists, CHTs.
Yeah.
But they like my practice and they know I get good results, and they also know how I train my therapist. All 3 of the therapists that work for me were students under me.
That's awesome. That's awesome. So tell us, you've been in private practice for a while. What you said you made some mistakes. I know that my first year I didn't know what I was doing. You kind of just like throw yourself out there and be like, I can do it. And what would you say was like a huge mistake of yours?
Probably the contracts. I didn't realize that you had to go through all the contracting and what all you had to do. It's really hard to get started because you have to have a physical location before you can bill, and then you can't bill really. I mean, it's kind of a catch-22.
Yeah.
Especially with Medicare and with Blue Cross, and those are your first ones you usually go after. So we started out slow and then just kind of built on it. But you know, and then revisiting those contracts about every 3 to 5 years, I go back to the insurance companies, and that's something that probably OTs and PTs don't do. And I work my own contracts. I don't let my office manager, who's awesome, do it.
Yeah.
But I've done PowerPoints. I've proved that I'm not the, because I'm in such a specialty. And,
Yeah.
but I've proved that I'm a little bit different animal, and I treat really traumatic injuries and get good results.
Right.
So I've kind of proved my worth, and they tend to listen a little bit better when you actually do the talking and not
Absolutely.
someone who doesn't know. So I think that's
Okay.
probably advice if you're going to do
Oh,
it, is run your practice.
That's great advice for anyone who's coming and looking to open their own practice, because we do tend to, when we don't know credentialing, right? We don't know credentialing, you do kind of pass the bucket to someone who does. And you're essentially saying, like, pass the bucket. Don't pass the bucket. Do it yourself.
Now does some of that, especially with the new therapists coming in. But as far as the contracts go, you
need to go in there, and you need to specify, and you need to show up and say why, you know, with the specialty, why they should be paying you more, right? That's pretty much what you're saying. Like, I'm Eizabeth. I have this, I know how to get people better. You need to pay me more to get your people better.
Yes.
Oh, that's good stuff. That's really awesome. You know, one of my things with being on this journey of being in private practice is I've learned a lot about myself, you know, in these last couple of years that I didn't really think I would, you know, like you go on this journey, you just kind of creating like a job, building your career. What would you say that you like really learned about yourself as a person that you didn't really know before?
I like the business aspect. I mean, I love the therapy, but I really like the business aspect. And 2 years ago, I graduated with my MBA.
Congratulations.
So I was 56.
Yeah.
Well, actually, I was 58 when I went to school. So I graduated when I was 60. And I was the oldest one in the class.
But you know what? We're like the more studious ones, right? When, like, as you get a little older, a little bit more mature, like you're just more serious, like you just study a different way, wouldn't you say?
Yes. And also I'd owned a business. So I had a little bit of a leg up on it, especially the entrepreneur part of it.
Yeah.
You know, some of the finances and learning accrual accounting about killed me, and economics. But you know what? I feel so much better now about making my decisions business-wise, because I know how to do the math, work it out, do scenarios, make sure I'm making the right calls. So if you're going to own your own business, I think you've really got to make sure you're running the business and that someone else, you're not relying on somebody else to do it. Now somebody does do my billing and all that, but I keep on top of them.
You have to. Yeah. I'm learning so much about numbers, and I always used to say that I was not good at math. And the only thing I do nowadays is math.
Right.
Because everything comes down to numbers. So, so you started your business, you've been in business for a while. When did you decide to write this evidence-based protocol book?
Okay.
When did you have time, Eizabeth?
I know, really. So I think in 2015, I go back to actually 1985. When I worked in Alabama and also at MUSC, we treated all the trauma. So flexor tendons, extensor tendons, anything and everything came through our clinic with the doctors. The doctors would immediately send them, you know, to us to get them started. And then we would refer them out to other places, so closer to home if they were 3 hours away or 2 hours away. So my surgeons were like, we want a protocol written up that we like, we approve, and base it on research. So I've been doing this my whole career.
Wow.
About 2015, one of my surgeons that was a very big referral source retired. And it left a big hole in my practice till they replaced him. And so I had all this time and I thought, no, I need to go back and, you know, revisit because they're not updated. So I started doing them. Then I started adding to them. And one of my therapists looked at me and said, you need to publish this. And I said, you know what? I think I do. So I contacted an attorney that I'd worked with before. He gave me somebody in his office. I looked into publishing it through a publishing company, but they wanted to put it in Barnes and Noble. And I'm like, that's not my niche market.
Yeah.
So I looked into self-publishing and I wrote the book. I paid a self-publishing company to put it into a format for me and to print it. I did it spending money, not knowing if I was going to get any return on how it was going to be received. And then in 2015, it takes me a year to write this. I mean, this took a year to redo it, and the first one took a year to even do it.
Well, the amazing thing is more than a year, Eizabeth. You're like from 5, you've been like pieces of paper, and then you took all the papers, not just written down, but the ones that are in your head, filed out, put it out. So like a whole career, but it took you a year to put it in print.
It took 100 copies of books in suitcases to the AFHT meeting, rented a booth, and I sold all 100 that first year.
Wow.
So word of mouth, you know, I worked with some other people that helped me kind of get started, which is good. This next version though, I decided I wanted to do it all myself. I went to school to learn how to do a lot of this stuff. And so I kind of said, you know what, I love the self-publishing because if somebody asked me, say they're going on a mission trip and they are looking for some donations or something, I had the privilege to give them that book. If I so choose, and to donate that book to a very good cause to people that really don't have access to anything. And I like the control that I have over it. You know, that I can share it without having a publisher, you know.
Right. Yeah. It's definitely different when you have it like published by a big publishing company. Yeah, it's a lot of work. I published a book, but nothing nearly like yours.
This one I loved. You know, the first one was scary, and this one I actually really enjoyed it. It added that new clinical pearls section that is my favorite part because there were so many things in reading the research that I would go, oh my gosh, that's kind of cool to know, but it really doesn't fit into a protocol. And so I decided to add that to each one so that I kind of gave a glimpse of research that's out there and little tidbits and outcomes and maybe future things that are going on in other countries, but not really proven yet. And I said that in the book. So all these little things that people will read, and maybe I'm just such a nerd, but I really enjoyed finding those little things and then sharing them. So I had to pour over stacks of research each one, but you guys get the privilege of me teasing out what's—
That's right. That's why we should buy your book. So I love the fact that you have a paper book, and I love the fact that you have a e-online version as well.
Yes.
And I have a lot of people who started watching what I was doing on Instagram or Facebook, and I put out a free 30-day hand therapy training, and I've been getting a lot of people enter that program worldwide. You know, and I think that a lot of people who come from other countries, they're telling me the same things. I'm getting on calls with people from all around the world, and they're telling me the same thing that we hear here in the United States, which is, I really want to specialize in hand therapy and upper extremity management, but I have no one to like really help me or mentor me. And so I'm like, I'm really proud and honored to mention your book and to send them to your website, really, to purchase it, because they're overseas, they can get the e-version of it. And one of the things that I really liked about it was, if you are beginning in it, you've got those clinical pearls. Like you've gotten, like you did tease out all this information and compartmentalize them in these little bite-sized, I call them bite-sized pieces that are easy for people to consume and to learn really quick when they're, most of the time they're going to a protocol book because they're like, oh my God, I have this case coming in this afternoon. I don't have read a whole chapter. I'm going to read this one little tidbit. It's going to help me get started. It's going to help me carry through.
Right.
And then if I want to read more to fortify my understanding of why, then I'm going to go into the textbook.
Yes.
So that's what I really enjoyed about your protocol book. I've had a lot of people ask me.
I did ship international, the printed book, but there's some really problems right now with suspended shipping in several countries, like South Africa. I couldn't ship to.
That's where I'm getting people calling
Yeah.
from. So
yeah, somebody in South Africa. There was somebody in. I just shipped. I was able to ship to Turkey. I just got one out, but there's a whole list of countries that, you know, so now at least if they want it, they can get the e-version. I also did a bundle that if you buy the printed, then you also can get the ebook for half off. So I think I forgot how much it is now. It's like $264, but you get both. And when you get the e-version, you get it 2 ways. And you have unlimited downloads as long as you are personally downloading it, not sharing it.
Right, yeah.
On your computer, on your phone.
Yeah.
So I have it on both also, which sometimes if you go to another clinic, you don't have to have the book. You can just look it up.
Yeah. I like that. I like that. We're going to get the e-version for mine as well. But I've had people from Brazil. I'm actually going to lecture at a conference in Brazil, like virtually. But definitely when I posted about the book, I had a lot of people interested. And I like the fact that they can get it, you know, if they can't get it shipped. I'm a person that loves like the physical book.
Me too.
Not everyone can get the physical book, but I do like even as I'm teaching and helping OTs pass the CHT exam, you know, the rehab of the handbook, like I lug that book home with me. I'll go home and I'll read and I'll study. I love the fact that you have it, both options.
Yeah.
Who doesn't like options?
Exactly.
Awesome. Well, I'm really excited to share in the link below. I'm going to share your website so people can, as they find this show over time, can go and be able to purchase it from you. Now, you have been practicing for a really long time in hand therapy. I was hoping that you could share with the audience maybe one thing that you do really well or that you teach your own staff so that someone who's watching this can take away right away and apply to something they're going to do with their patient.
You know, I've been really thinking because you gave me a heads up on that question. And, you know, one, I love tendon repairs. I mean, that's actually one of my favorite things, and I think I'm very good at it. But I think it's also so much that what I see now is that I put some things out there that I actually did. A physician asked for a Kleiner because there was a reason, and the patient did fantastic. I've had several of those. I'm not afraid to do that. And I think they move very well. So I know the move is to go early active, and we do that too. In fact, we do it a lot, but that doesn't always fit the person. It doesn't fit, you know, their age, their lifestyle, maybe they can't come into clinic as much as you want them to.
Yeah.
One thing I'd like to just share is that really be open to not thinking that, you know, the book actually gives you several options.
Yes.
And they all are good.
Yeah.
I mean, Duran, I've gotten some great stuff from them. I do think that one thing that I do that's a little bit different with my tendons is that, especially with a Kleiner and the Duran, is I tell them they need to do it every 15 minutes. You know, you can put fingers in traction, even if you've got a Palmer bar and you keep them like that for an hour, are they going to get a contracture? Yeah, probably. But if they do it every 15 minutes, you're actually doing it more often. They don't end up, if they do end up with the small contracture, I easily can work that out even in the beginning, and I'm being real careful.
Yeah.
And I get really good results because they're
With the
constantly getting that excursion and not letting it sit for an hour.
So I'm going to explain what the Kleinhardt is just in case somebody doesn't know, but basically the position is the wrist in slight flexion, the MPs in slight flexion, the IPs are straight, and they have the hooks here on the nails, right? And then the rubber bands pull them down. And then what they do is they go into active extension. and then the rubber bands pull them into flexion, and they go into active extension. So when they have that on, you're telling them to exercise, go into active extension every 15 minutes.
Every 15 minutes.
And then at night, you take them off the rubber bands and you have a plate bar there to hold them. Their IPs are straight.
Yes, except for when I have an FDP repair, I actually don't cross the FDP. I want that FDP to sit in a little bit of flexion.
Okay.
And I find that if they got a flexion contracture, I usually can work that out easier than a lag. So why not let it sit in a little bit of flexion, and you're not putting pressure on it, and I get better results that way too.
Okay.
That's definitely in my book. Those are little things that have I seen that written in research? No.
Yeah, but that's why you're sharing it here, so people can know. Like,
it definitely is research based, but there's a little bit of me in there.
Yes,
too.
of course. You know, not everyone can come work for you. You only have 4 spots. Thousands of therapists that are like clamoring to come work with a hand therapist like you, and they're going to watch us. They're going to be like, oh my God, yes. So I always tell therapists that they need to understand the positioning and all that stuff, but then know the different protocols, because you're right, Eizabeth, that not everyone fits the same protocol. Like, yes, right now there's the early active, that's really huge, but you know, a couple years back it was Duran, right? Before that was the Kleinhardt, but I don't have too many doctors that order that anymore. Who do you think that fits best with the Kleinhardt? What kind of patient would benefit from that?
Really based on my surgeons make that call. But like the last one I did that did beautifully, she was started with us, but she went down to a smaller town where there is a CHT, but the doctor's not as familiar. And so she couldn't go to therapy, but maybe once or twice a week. And I think he just felt like that was a little bit safer. And it ended up that she was supposed to stay down there, but she decided to come back because she just liked our clinic and her parents were happier up here.
Right.
So I got her about a week later, but it was kind of it was too long a period to start that active, because you have to do that really between 3 and 5 days. So we just continued the way we were doing and did a lot of tenodesis and really worked out stiffness. And she pretty much has she is 3.5 weeks and she has a composite fist. She's probably lacking maybe 15 degrees of DIP flexion, and that's it.
That's amazing. 3.5 weeks? That's really great. So if someone does, like if the doctor doesn't ask for a Kleinhardt, but you really thought, like I'm a big believer in like asking the surgeons, you know, like, hey, I think this, I want this, I want this. Sometimes you get in, sometimes you don't, you know. But I'm a big believer in like, hey, if you know your stuff, ask for it. Like, would you ask for a Kleinhardt on somebody who was potentially, they were younger and they wouldn't necessarily come to therapy that often? Or would you ask for it based on if they were really stiff or swollen? Like if you had to go to the surgeon and ask for it?
That's a good question. If they were really stiff, see, we don't get too many swollen and stiff hands. I mean, we get stiff but not swollen, because my surgeons are really good about that. But I probably would ask for that. If there was somebody young, probably they would lean more toward the Duran if they didn't trust them, knowing that they're going to probably cheat a little bit anyway, and knowing that maintenance, you know, there definitely is a maintenance issue with Kleinhardt, with all the, you know, the rubber bands and the all that kind of stuff. But my doctors are really aggressive. So if they feel like there's a reason, like the one person that we did that I remember who was very intelligent came in, he would have been good for early active, but he was a skill saw injury, which takes a hunk out of the tendon. The tendon, when they put it back together, was a little bit shortened. He almost had his finger amputated. So it wasn't just, you know, a very clean cut. He really did wonderful, other than he did get a PIP joint contracture. But his excursion was great.
Yeah, as long as their excursion is good.
Right. And then he went back and got that joint released, and he did beautifully.
Yeah.
So, and then we've got a couple of early actives right now that are doing wonderful. So the surgeons are pretty good that I work
Yeah.
with. They're very aggressive, and if they think they're being safe, then there's reasons usually.
Yeah. Yeah. So that's such a great point. So not everyone works with hand surgeons, right? And not all hand surgeons are created equal, right? Just like not all therapists are created equal, right? So do you have any great tips for someone who is a flexor that comes in and they're really swollen? I'm asking you all the tough questions. I want people to like get your benefit.
So, I mean, elevation, I mean, you can't put a glove on them. It's almost impossible to do that because you can't position them safely and get a glove on. So I think just elevation, and you can, if you're doing passive range, you can Coban wrap, but you can't really Coban wrap if they're doing any kind of active because you're putting drag on the tendon.
Yeah.
So, you know, I probably would just kind of work it out myself. You can do a little bit of lymphedema stuff, which I do some of that.
Yeah.
I haven't seen one of those in so long, honestly.
You're lucky.
I know.
We see them all the time, and sometimes it's due to delay, sometimes it's due to the nature or the severity of the injury, but yeah, sometimes people come delayed. You know, we'd love to see all of our cases really early, but we don't always get to see them really early. I usually, one of the things I do is I'll do the retrograde massage, but I'll do the Coban wrapping at night.
Okay.
Yeah, I'll do the Coban wrapping at night because during the day you want them to move. Like during the day, they're going to do the passive range motion, and they should be doing some retrograde on themselves, and then just doing some once they get started with active and stuff like that. But yeah,
and I do understand therapists that maybe get frustrated because their doctors are kind of old school. But I think then you go, and what I've done in my past, because I was doing early active with 2-strand repairs. So that was, you know, way back when, before we're getting into the 4-strand, you know, and that was pretty scary. And I did it. I talked my surgeon into it, but I showed him the research. So I pulled up all the articles and said, listen, I highlighted them and said, what do you think? And he goes, oh, okay, you know. And we didn't rupture any. We learned a lot during that process.
Go wood.
But now it's safer to do it.
Yeah, it is safer.
Yeah, the big thing I think is patient education. Just tell them, do not do this. You know, you have some knucklehead that takes it off and ruptures. You can't have those.
Yeah, I had somebody who, she was much older and she was already with underlying dementia, but the family didn't really know when she went under anesthesia for her surgery and stuff like that. By the time she came in, and this was a great hand surgeon I work with, and he sent her 3 to 5 days, but she came in, she had already fought her splint off, like her post-op. You know, those post-op things are huge, and it was like half hanging out. She was like coming in carrying it. And I'm like, what happened? Who are you fighting with? And the family was like, we don't know what happened. She woke up like this. And turned out she had ruptured her tendon, fighting it off. I kind of suspected and told him right away, like, I'm suspecting, I don't feel anything from day one. And it was like, well, it's too late. We can't really do anything. So we kind of waited and stuff like that. She did the rod placement. Then she went and had the reconstruction. Came in the second time after reconstruction, fighting her splint, and she ruptured it. Was feeling some kind of way, claustrophobic or whatever, but that dementia that was underlining, that the family was like not telling us about, as we spend time with our patients, we're like, I think there's some underlying dementia stuff. Like, is she forgetful? And they're like, yeah, we think so. We've just been in denial. So yeah, that was my only, knock on wood, only rupture, but she came like that.
Well, and that, you know, you kind of, I don't know, that's an awful lot of, that's a huge surgery to do this 2-stage. And then go through all that and rupture again.
Yeah.
You know, knowing what you knew the first time, I don't know.
Yeah. I think they were, you know, they were really in denial about the first time, like, you know, that she was starting on this path. You know, even though it wasn't successful, they were, in the end, they were like, well, we tried to get her like the most that we could. And then in the end, she was like, okay, I'm fine. Like a
Exactly.
finger sticking straight up like that. And, you know, but, oh, thank you so much for coming on, sharing your stories and sharing your protocol book with us. I'm going to include the link where anyone can, you know, whether you're starting out in hand therapy or you've been in hand therapy, this is a great protocol book for you to have, not only in your clinic, but if you have it for yourself, then no matter what clinic you go to, you can take it with you. There's a physical book that you can purchase and an online version. So I'll include that link for everyone who comes on and is interested in getting your book. Thank you so much for sharing everything, Eizabeth.
Thank you very much. It was very nice to meet you.